You are listening to the Keeping It Juicy podcast,
your main squeeze in nutrition.
Don't forget to subscribe so you can join us every Tuesday for a brand new episode.
Also, don't forget to add us on Instagram and Facebook at Keeping It Juicy Podcast. All right, guys, welcome to episode 85. We're going to talk all about the psychological and physiological effects of racism in healthcare. And newsflash, there's racism in healthcare. But before we do go into that, we're going to go into our new nutrition in the news.
Yes, so today's new nutrition in the news is called Tea Drinkers Live Longer. And I chose this article because for a couple reasons. One of the biggest frustrations I have with the nutrition field is that these bold statements are made about individual foods that promise, these crazy, beneficial things in your life. And this is an example of one of them. But this was actually, a scientific study. And I just want to go over it so we can pick apart how science gets turned into these kind of cliche, catchy news titles and how that can be easily misconstrued by the general public and sometimes us too. So let's go into that. The study states that drinking tea at least 3 times a week is linked with longer and healthier life, according to a study published in the European Journal of Preventive Cardiology, a journal of European Society of Cardiology. So habitual tea consumption was associated with more healthy years of life and longer life expectancy. For example, analyses estimated that 50-year-old habitual tea drinkers would develop coronary heart disease and stroke 1.41 years later and live 1.26 years longer than those who never or seldom drank tea. So basically, if you've been drinking tea for 50 years, you'll develop heart disease 1.41 years later and live 1.26 years longer than someone who doesn't drink much tea.
Seems like I already have a leg up on this.
Oh my gosh. I mean, that's significant. One-ish year, give or take, but let's dive a little bit deeper into that. So compared with never or non-habitual tea drinkers, habitual tea consumers had a 20% lower risk of incident heart disease and stroke, and 22% lower risk of fatal heart disease stroke, and 15% decreased risk of all-cause death. So if you drink tea, according to this study, you have a 15% less chance than dying. Last time I checked, we all die. So just one of the... Not to be like a
don't be saying that.
but last time I checked, we all eventually kick the bucket. So it's so interesting to me how these sentences get framed and whatnot. But let's continue. The potential influence of changes in tea drinking behavior were analyzed in a subset of 4,081 patients with assessments at 2 time points. The average duration between the 2 surveys was 8.2 years, and the median follow-up after the second survey was 5.3 years. So a pretty long time they're following these people. Habitual tea drinkers who maintained their habit in both surveys, so after the 8.2 years and after the 5.3 years, had a 39% lower risk of incident heart disease and stroke, 56% lower risk of fatal heart disease and stroke, and 29% decreased risk of all-cause death compared to inconsistent, or never non-habitual tea drinkers. So just another subset of this study kind of showed similar results. But then in a sub-analysis of tea by type, drinking green tea was linked with approximately 25% lower risks for incident heart disease and stroke, fatal heart disease and stroke, and all-cause death. So green tea was kind of like the primary driver of a lot of these results. However, no associations were observed for black tea. According to this study, 2 factors may be at play. First, green tea is a rich source of polyphenols, which protect against cardiovascular disease and risk factors including high blood pressure and dyslipidemia. Black tea is fully fermented, and during this process, polyphenols are oxidized into pigments and may lose their antioxidant effect. So that's maybe why green tea had this more protective benefit where black tea didn't. Secondly, black tea is often served with milk, which previous research has shown may counteract the favorable health effects of tea on vascular function. So potentially a confounding variable there. My thoughts on this is I think there's a huge lifestyle pattern at play here. Maybe tea drinkers are more health conscious than coffee drinkers or energy drinkers. The study did not look into other lifestyle behaviors as a confounding variable whatsoever. If someone is an avid tea drinker for 50 years, there's probably going to be some other habits that they do that kind of you can see across many different tea drinkers. So I'm disappointed that it didn't look at that. But research always starts somewhere, but I do think that's something to
Right.
keep in mind. Lifestyle choices.
Right. And a lot of these studies are, as you, if you guys have tuned in for our past episodes, have never looked at these patients or people in a holistic view at all. They've always looked at very little things in their life, and then they have prove an association. I mean, unfortunately, with nutrition, there's going to be a lot of research that goes along with those guidelines, and it's really difficult and expensive to
Mhm,
pinpoint
mhm.
specific causes
Right.
within nutrition, and you
It's
still get
challenging to do. It's challenging to even develop a research model to
right.
get a good study to make those correlations are,
Hmm.
easy, but cause and effect are extremely challenging to
Oh
prove
yeah.
in research and challenging and expensive. So
Hmm.
I thought this was a valuable thing to talk about just because when you start seeing, I mean, it already exists, but green tea is a fat burner. Green tea makes you live longer. You need to know like where that research is
Right.
coming from and think about the big picture. So there are studies to support that,
Hmm.
but how much weight do they carry? Maybe a lot, maybe not a lot.
Hmm.
Fortunately for us, there's not really many negative side effects with drinking green tea. So if you want to
Yeah.
start that as a new hobby, go for it. There really hasn't been any seen negative effects, but unfortunately, there are a lot of nutritional habits that sometimes carry negative effects as well. And studies kind of like this are what get those crazy headlines, and it just snowballs.
Exactly. Well, I don't know. You guys let us know your thoughts and feelings about it. I myself am a coffee and tea drinker, so I'm a
Mhm,
little bit of both.
mhm.
But people can be both. People can be none at all. That's totally up to you and what you want to do. So let us know your thoughts, feelings, concerns about this new nutrition in the news.
Right.
But with that being said, we're going to move on to the bulk of the episode, which we're not going to drop the conversation. You guys already know, because we don't want you guys to forget this conversation. So, what are the psychological and physiological effects of racism in healthcare? And as we know, there are certain social determinants of health that affect some communities more than others. If you don't know what we're talking about, please go to one of our previous episodes where we talk all about it. There are social determinants of health that include but are not limited to income and health and social status, employment and working conditions, education and literacy, childhood experiences, physical environment, social support and coping skills, healthy behaviors, access to health services. This is all very important. I mean, health disparities are the results of social determinants of health. A health disparity refers to a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. A healthcare disparity typically refers to differences between groups in health insurance coverage, access to and use of care, and quality of care. As you can imagine, if you're uneducated, the chance of having a job with great medical care is very slim. I mean, I'm educated and it's still expensive to get a good healthcare or insurance or anything. So if you aren't educated and you don't have good healthcare, disease prevalence may be higher, especially if living conditions are pretty much suboptimal. Exposures to pollutants and little access to fresh food are just great not great, but like general examples of this. And some of these factors are purely socioeconomic, but it is arguable that the socioeconomic gap exists because of racism, discrimination, and prejudice. Now we are going to go into some of the effects of this within our healthcare system today.
Right. So this is kind of a touchy and uncomfortable topic, but it needs to be talked about more. And before we really did some of this research, I didn't know some of these statistics and issues that were going on. So that's why we're sharing them with you all today. So first, we're going to specifically focus on Black women in healthcare. So generally speaking, there are actually a lot of studies that look into this, but studies show that Black men are consistently viewed as bigger and more muscular than white men of the same exact size. So studies actually show that. Black men and women are physically stereotyped in many contexts. We've often heard they're natural athletes instead of intelligent ones, or they're able to bear inordinate amounts of pain and suffering in depictions of entertainment and pop culture. I'm sure you've seen different movies and TV shows where you can kind of pinpoint exactly what I'm talking about. They're stereotyped a certain way and perceived a very different way. And there are a lot of scientific studies to back this up versus just our kind of pop culture context of it. So how does this all relate to healthcare? So because Black women are seen as strong and more resilient, however, that doesn't mean they hurt or feel pain differently than any white or Latina women. So Black women are actually 3 to 4 times more likely to die from pregnancy-related complications than white women. Black women are also 3 times more likely to suffer from a severe disability resulting from childbirth than white women. So, what's my point here? It is argued that Black women are dying from childbirth at an alarming rate because doctors aren't taking their complaints seriously because they're seen as more resilient and stronger and tougher.
Right.
And this
I've
stereotype,
I've heard this stereotype actually a couple, like multiple times before, and I'm like, that does not make any sense.
it does.
Like, I don't.
But when you have discrimination and prejudice,
Mhm.
you're looking through a filter. You know, you don't see
Right.
it, and that's an issue.
Mhm.
Genetically or biology wise, they should not be dying and having these complications. There has to be another factor. Is it this one? Maybe, maybe not.
Right.
But something that needs to be thought about because something's happening and something's
Mhm.
happening below the surface. Uh,
Mhm.
so think about that. Again, we're not saying that all doctors do this, but think about it and find some of your own statistics. And again, just think about it. And if you see something, say something. Pay attention in your workforce and see what stereotypes or just things that you hear people saying, because that's the only way those who, again, are living life through this discrimination filter, and they might not mean it intentionally. They probably
Right.
don't mean it intentionally. But again, you have these
Right.
preconceived beliefs about people that have been studied and
Mhm.
they're acting a certain way. So, something to think about and say something if you see something.
Mm.
Another point I want to make is that Black women are underrepresented in clinical trials that require consent and are overrepresented in studies that do not. While all, yeah, crazy.
God.
Yeah. While all women are maybe underrepresented in clinical research in general, a lot of research is done on men. A lot of formulas that we use for health, like the 220 minus your age for your max heart rate, that was based on like 20 white men in the 80s or something. So,
Ugh.
you know, we got some work to do in general, but it's an even more critical situation for Black women. They're just underrepresented in trials that do not
Mhm.
require consent. In fact, Black women, as we mentioned, they're actually also disproportionately impacted by uterine fibroids. Only compromise 15% of participants published in clinical trials for the condition. So they're mostly represented for this condition, but underrepresented for the clinical trials of it. You know, if this is truly a condition or disease that affects Black women mostly, because there are certain diseases and conditions
Right.
that affect certain races and cultures more than others, why is the research not being done predominantly on that?
Mm.
You know, if it's tricky.
Mhm.
In addition, data from the FDA shows that in trials for 24 of the 31 cancer drugs approved since 2015, fewer than 5% of the participants were Black. And we know that Blacks comprise about 13% of the United States, so very underrepresented there. The diversity in study patients is needed to ensure that new drugs are both safe and effective for all patients. Unfortunately, in contrast, again, Black participants are disproportionately overrepresented in studies that do not require consent. And we will have the source for that. There is a lot of other great information on Black women in healthcare, but
Mhm.
these 2 points, it's called the disparities in healthcare for Black women, and the show notes will have that link. So I highly suggest reading the whole website. But those two just stuck out to me the most as how race and the physiological and psychological things that come from racism in healthcare.
Right. Exactly. And then another thing that we talk about, but we don't talk about is cardiovascular disease. I'm sure you guys already know that deals with your heart. So with cardiovascular disease, there's a heightened environmental vigilance and surveillance among the Black population, and it's a legacy of the practices of oppression enacted over decades of racialized mistreatment in this country. So it's actually suggested that this lifelong stress and on the edge type of caution contributes to a cascade of physiological functions that contribute to cardiovascular disease. So, studies show that cardiovascular changes, as well as kidney function and neurochemical mechanisms involved in blood pressure and endothelial function, are affected by long term stress, including the stress of racism. The internalization of negative stereotypes has been positively related to psychological distress, lower self-esteem, and ego integrity in depression. Linked with excessive glucocorticoid production and high plasma norepinephrine levels, depression predicts future coronary heart disease. Furthermore, both the NHANES and the coronary artery risk development in young adults study found a greater impact of depression on cardiovascular outcomes among our Black Americans. So when anger is used as a coping response to discriminatory laboratory events, the magnitude of cardiovascular reactivity is even greater. So the take-home message is the daily chronic load of systemic racism and microaggression has been shown to negatively contribute to cardiovascular disease, and Blacks are much more likely than whites to have cardiovascular disease. I mean, just think about it. Like, we already know the effects of stress and how it can be expressed in a physiological way. Imagine having systemic racism and that just go throughout your entire life.
It's a
Like,
it's a being a white person, it's a very challenging concept for me to think about, but
mhm,
what helped me like really, I feel like that to the best of my ability, like understand this concept is think about like if you're at work and you have a coworker that hates you and just makes your life difficult and always kind of just like gives you dirty looks all the time. Think about how much you can internalize that a little bit. Now imagine
yeah,
if your whole community treated you differently.
right.
Like that's just one person at work who's a fucktard and makes your life difficult. Imagine if it's like people on a daily basis when you're at the grocery store, when you go
Mhm,
to church. No wonder stress levels and you're kind of always in that fight or flight mode.
right.
So that has a negative effect on your heart over your lifetime. So
Yeah,
they're related. They're
yeah,
absolutely related.
yeah. And if after this episode you still don't think racism exists in healthcare, then I don't know what to tell you. I'll be honest.
And we haven't even discussed in this episode, but you should know by now that Blacks are minorities and there are higher rates of disease because of food choices and availability. So not only do you have the stress of racism, it's the low income where you are not having good sources of food in your diet. So that contributes to disease as well. So it's literally this vicious cycle. We didn't even talk about food in this episode at all.
No.
Not even once. But still, taking food and nutrition out of the picture, there are still physiological effects.
Oh yeah, absolutely. So I don't know. Let us know your guys' thoughts and feelings about this episode. It's just something that we feel like should come to the forefront, and if we're going to be in the healthcare facility, if we're going to be talking with our patients, or even if it's like your friend or trying to educate your parents, anything. This is definitely something to think about. So
Just
yeah.
something else to think about. And with that, we are going to close out with our social media shout out of the week. It does go to Isabella Brown Nutrition. So thank you for your support. She's an RD, LD, and she posts tips on how to eat healthy on a budget, which can be super helpful. Also some other dietetic tips, such as how to pick an internship, and she does different RD to B shout outs. So she posts a lot of other pages and resources that you can follow as well. And we are sending the nice Keeping It Juicy stickers to all of our social media shout outs. So if you have been one in the past or are Isabella Brown Nutrition this week, please send us a message and we'll get one in the mail to you.
So like we said, if you want to be our social media shout out, definitely like our stuff, send us shit, comment on our shit, all the shit. But more importantly, we're thinking about having an upcoming episode on different internship horror stories. I know I have some, and I'm pretty sure some of you dietitians or current RD-to-Bs have some internship stories. So definitely send us your internship horror stories, or just shoot us a message if you want to be featured in that episode.
We can either, if you want, send us a message, we can read your horror story out, or if you're okay being on the podcast, we can bring you on as well. So if you have a internship horror story and want to share it, please reach out to us.
Yes, absolutely. So with that being said, COVID is still out there. Don't touch anyone. Don't let anyone touch you, because I'm not.
We're not messing around here.
Yeah, just don't fucking touch anything, man.
Do it.
The cases keep going up.
Yeah.
Unless you're in Europe, you're just absolutely
You're just
perfect.
chilling.
Yeah.
We're screwed though.
Yeah. What's new? So.
All right. Thank you guys for listening, and we'll catch you in the next one.
Bye.
Bye. Thanks for listening to the Keeping It Juicy podcast.
Your main squeeze in nutrition.
Don't forget to subscribe so you can join us every Tuesday for a brand new episode.
Also, you can find us on Instagram and Facebook at Keeping It Juicy Podcast.
We'd love to hear from you, so please leave us a review.
5 stars, no less.
On whatever platform you're listening to, or send us an email at keepingitjuicypodcast@gmail.com.
Or if you have any topics you'd like for us to touch upon, shoot us an email. Until next time, don't do anything that I wouldn't do.